So now we're in the off season of Advanced Therapies Think Tank. We're getting together with some of our faculty members looking ahead for season 2. So I'm here with Raphael, finding out what we want to be discussing in the next season. What's your most controversial opinion about the advanced therapies industry right now?
Well, I will take something that is in our backyard by emphasizing how people are so wrong about their understanding of natural killer cells. You know that our company is developing a engineered NK cells, and we keep hearing that, oh, NK cells don't work, they're not good, they don't provide good persistence, whatever. All this, when we ask them about evidence, is like, no, that's wrong, actually. NK cells can be very good killers of cancer cells in our case. They can be activated in a way that will make them persistent way beyond what we have seen in the past decade. And they can be a very good solution to get on the off-the-shelf therapy to bring cell therapy to more patients.
What's the most overhyped trend in cell and gene therapy right now? I know your answer to this one.
Of course, everybody's talking about in vivo delivery in cell therapy. And even if I strongly believe that that's the future, I also think that there's so much that needs to be done before we get to something that is really achievable and that can convert into a treatment. So many answers we need to get to, particularly on the safety side, on the risk of overdosing when we're going to be trying to treat solid tumor with this delivery. And the other thing I want to emphasize is that if you look at what they're doing in cell therapy in vivo delivery, they're focusing on CD19 and BCMA yet again. We need new targets. We need new approaches that are going to go beyond these two targets. We need new treatments that are going to go for large patient population that are not just expressing CD19 and BCMA, because this represents less than 1% of all cancers. We need options for other solid tumors, for breast cancer, for prostate cancer, for lung cancer, for colorectal, which is part of the things that we're trying to develop with our focus in our company. And even if I believe it's a hype, it will go somewhere. But in the meantime, there are other options that can make it to the patients and eventually to the market to help those cancer patients in need.
What do you expect we'll be talking about on Advanced Therapies Think Tank in the next season?
Well, I wish I would be able to say that everybody will talk about the cure NK cells of NK therapeutics, how they can really achieve great durable responses to patients. But we're not yet there. We're still preclinical. But I really believe that there are 3 main pillars that needs to evolve in the field of cell therapy. The first one is leadership in the US is gone on cell therapy. It's coming from Far East in China. It's an opportunity for everybody else to put their act together, surf the wave, and be able to, at some point, bring new technologies, regardless of where the funding is coming, regardless of where the technology is coming. The second pillar is about manufacturing. We have made significant progress on autologous manufacturing to make it much better, much less risky, much less difficult, but still not that scalable. The era of allogeneic and off-the-shelf technologies is here. We need to accelerate that to have an alternative to autologous CAR-T. And then the last point is about innovation. This industry is founded on innovation. If we keep investing on only we have been proven that works, then we're not innovating. It's time to look at other alternatives, other modalities, other targets. Yes, we need to take the risk, but I know some people out there are ready to take the risk. We just need to deliver the science and continue to show that novel things can make a difference. And I am convinced that the faculty and the people involved in AT3 will be able to find those nuggets to disclose to the world that we are going in the right direction.
Thanks, Raphael. Really looking forward to hearing more from you in season 2.
Thank you.